another TGIF episode on the Anti Pharmacist podcast, and I welcome you once again. Yesterday was World Mental Health Day with the theme Mental Health at Work. This brings to our attention once again the importance of mental health, especially in the workplace. Guys, your mental health is non negotiable. I mean, how can you even function when your mental health is in question? You won't be able to perform your duties at work optimally if you're experiencing things that are threatening your mental health. I'm sure a lot of you guys understand what I'm saying. A boss that has become a source of panic and unrest, or even colleagues. Harassment at work, low self esteem at work, being overworked and underappreciated. All this impact mental well being negatively, and we should try as much as possible to avoid situations like this. If where you're working is not giving you peace of mind, find ways to avoid the situation, address it, or change location altogether. There are psychologists around nowadays that can help you navigate your mental health challenges and ensure your holistic health. So be sure to engage their services when required, okay? Well, that wasn't even my topic for today, but I had to talk about it briefly. Now, to my main topic for this episode. October is Breast Cancer Awareness Month all over the world. This is in a bid to reduce the incidence of breast cancer by making campaigns about it, creating awareness, talking about the risks, the preventions, even the treatment if possible, okay? Which is why I'll be talking about that right about now. So let's get right into it. Cancers are a huge global health concern, no doubt. In fact, they are a menace, and there are lots of them. But breast cancer is an especially common type of cancer. It is, in fact, the second most common cancer worldwide. Okay, it affects a lot of people, women especially. So, for today's episode, I'll be laying emphasis on risk factors and prevention of breast cancer. And I'll be touching a bit of, breast cancer self examination. Okay. So, let me just explain what breast cancer is about. Okay. Breast cancer is a disease in which abnormal breast cells grow out of control and form tumors in the body. If it is left unchecked, the tumors can spread throughout the body and become fatal. That is, they can cause death. Okay. Breast cancer cells begin inside the milk duct or the milk producing lobules of the breast. And the earliest form is not life threatening and can be detected in early stages. These cancer cells can spread into nearby breast tissues and it creates tumors that causes lumps or thickening. Invasive cancers now can spread to nearby lymph nodes or other organs. This is called metastasis, and metastasis can be life threatening and fatal. Treatment is personalized and it depends on the type of cancer and its spread, how far it has gone in the body. So, treatment usually combines surgery, radiation therapy, and medications. That's just a brief introduction of what cancer is really about, okay? But I'll be laying emphasis today on risk factors and prevention of breast cancer because, in actual fact, one cannot pinpoint a particular cause of the cancer. We can only guess the causes most times. All we can do is to try as much as possible to stay away from those things that we think can cause breast cancer. That is, if they are within our control, and quickly find solution to those things that we can't control before they get out of hand. That is why early detection is very important. However, did you know that breast cancer does not only affect women? It affects men too. In fact, statistics shows that about 1% of men have breast cancers globally. That may seem insignificant to you because it's only 1%, 1 out of 100. But that runs to thousands yearly in actual numbers. Most men are flat chested, yes, but the breast cells are still present in all men. So, these risk factors and prevention tips that I'm going to share today are not only meant for women. Please note this. Now, let me quickly go through the risk factors of breast cancer. Okay, so when we talk about risk factors, there are things that predispose you to breast cancer. Okay, while some may be under your control, others may not be under your control. Might just be something that happens and there's nothing really you can do about it. Okay. So the risk factors that you really can't change that are out of your control are: one, getting older. The risk for breast cancer increases with age, really. So most breast cancers are diagnosed after the age of 50. So getting older is a risk factor. You should be more careful about your breast once you're getting older and you are above 50. Then another thing you cannot control or change is genetic mutations. There are some inherited changes to certain genes in the DNA of an individual, like the BRCA1 and BRCA2 genes. They actually increase the risk of breast and ovarian cancer when there's mutation in them, okay? Then reproductive history is another thing you can change. You know, when you start your menstrual period early, before age of 12, and your menopause is late, like after age 55, you are exposed to hormones longer, and this raises the risk of breast cancer. Another risk factor you can't really do anything about, or should I say you can't change, is dense breasts. When you have kind of big breasts and they are dense, it can predispose you to tumors, and it can make it hard for you to actually see tumors on mammograms. Even when you do some self breast exam, it can be difficult to really notice that there are lumps or other things that can be indicators for breast cancer, which can help you detect them early. Okay. Then personal history of breast cancer or some non-cancerous breast diseases. When you've had breast cancer in the past, there's a high risk that you can have it again. Okay. Then some non-cancerous breast diseases like hyperplasia, some carcinomas, you know, they predispose you to a higher risk of breast cancer. Another thing is family history of breast cancer or ovarian cancer. When you have somebody in your family that's had breast cancer before, maybe your aunt or your mom or your grandmother, you are at higher risk, okay? Especially first degree relatives like your mother, sister, or even any family on either of the parent side. There is high risk of having breast cancer. Then when if you have used radiation therapy before, you know you've been exposed to radiation for some reason, maybe to treat even other types of cancer, then you have higher risk of getting breast cancer later in life, especially when you're exposed to this radiation before age 30. Then exposure to some kind of hormonal drugs also increases your risk for breast cancer. The likes of diethylsibelstrol. It was discovered that when it was given to some pregnant women in the United States some decades back to prevent miscarriage, they had higher risk of getting breast cancer. And women whose mothers took the same drug while they were pregnant also had higher risk of breast cancer. Now, talking about risk factors for men, although they're similar to that of women too, but there is just a slight difference, okay? For men, risk factor for breast cancers include obesity, undescended testicular swelling due to diseases like adult onset mumps, removal of one or more of the testicles, then estrogen treatment for hormone replacement therapy given to men with prostate cancer. Then gene mutation is also a risk factor in men. Now, talking about risk factors that you can change, that you have control over. The first one is physical inactivity. When you're not physically active, you're predisposing yourself to even any type of illness, and breast cancer is, of course, one of them. Being overweight, obesity, especially after menopause. I've talked about obesity for men. That's a risk factor. It is one that can be controlled, that can be changed. So if you're overweight or have obesity, you have higher risk of getting breast cancer. And that should be telling you what prevention tips you should take note of, right? Then taking hormones, hormone replacement therapy. I've mentioned it for men. It is same for women, estrogens, progesterone during menopause. When you take them for long term, chronically, for more than 5 years, or certain oral contraceptives as birth control, especially birth control pills, they raise the risk of breast cancer. Okay. Then, if you have your first pregnancy after age of 30 and you do not breastfeed, you do not have full-term pregnancy, it also raises the risk of breast cancer. Okay. Like I said, these are risk factors. It doesn't mean that it will definitely happen. Either you can change them or not. But these are things that we ought to know just so that we can be aware and do all in our power to avoid them. I hope you get me. Okay. I've said it over and over. Drinking alcohol is not good for you. No matter what good you think it does to you, it does more harm than good. So why not avoid it? See now, it's another risk factor for cancer, another diseases that I've mentioned here. So please avoid it if you can. And if you can't, please reduce it to the barest minimum. Also, research has shown that factors like smoking, exposure to chemicals that can cause cancer, and hormonal imbalances changes, especially due to working at night, night shifts may also increase risk of breast cancer. So all of these are just to tell you what to avoid basically, okay? So that is it about risk factors. Now, before the prevention tips, let me quickly go to the tips for self-examination of breast. What are those things that if you see, it would alert you that, oh, this might be breast cancer? Okay, for men, number one is mass or lump in the breast. Okay, there's nipple discharge as well. It may even be blooding. Another one is nipple retraction. It will be turning inward. Then skin ulcers, like open sores on the breast. If you see any of this, you have to go do a skin imaging as soon as possible, as well as breast biopsy. Okay, to diagnose especially male breast cancer. For women, you can look for skin changes in your breast, like some parts are sagging, than others. You are noticing that it is more discolored than other parts of your breast. Also, redness or rash around the breast is another thing that you should be careful of and watch out for. Okay, dimpling, some parts just dimple like a depression in the breast. It could also be an indication of breast cancer. So please look out for those in your breast. This takes me to breast self examination, because if you don't do this, you may not notice all of this that I've mentioned. So let me quickly guide you through how you can perform a breast self examination. And this should be done about 3 days after your period each month. That's for women. And for men, you don't really have to go through all of that. Just notice those signs that I have mentioned earlier that could indicate possible breast cancer in men. Okay. Number one step in breast self examination is just look at your breasts, your nipples, and your armpit. Take a good look at them. Okay. Stand in front of a mirror and look at them. Look at yourself very well. Then check the size, the shape, the color. Just note if there's any changes from before. Then look with your arms by your side on your hips. Raise your hand up to see if there's any abnormality, if there's even if you feel any pain. Feel your breast for lumps in a circular motion. You use your left hand for your right breast, your right hand for your left breast. Okay, in a circular motion, use your fingers to press around your breast, not your nipple area, but around. Okay, to feel for lumps like that. Then pay attention to the skin over your breast and armpits. If you notice any redness, rash, dimples, or if the skin looks different than what you're used to, then that could be a red flag. Just try and note those things. What about your nipple? Are they still pointing out? Are they pulled inwards? Press the nipple and areola to see if there's any discharge. If blood, pus, or milk is coming out, that might be a red flag as well. Feel for lumps Are the lumps soft or hard? What is the approximate size? What are the locations of the lumps? These are the things you should note. Is there any change to the skin over the lump, if any? Maybe rash, redness, Are you feeling any pain? Is the lump visible without even touching the breast? If you can see something protruding out of your breast, then that could be a cause for concern. So what to do next is go straight to the hospital, go see your doctor, in this case your gynecologist most likely, and if you see a general practitioner, I'm sure they will direct you to the right specialist, and they will take it from there. They'll do the imaging, the biopsy I talked about earlier if necessary, and you get your results. Okay, that is it about breast self-examination. So before I go to preventive measures for breast cancer, I will be debunking some rumors about breast cancer. Okay, I'll just talk about two of them right now. The first one is that antiperspirant or deodorant cause breast cancer. There are a lot of things that go around online, misinformations here and there, but no study has shown that antiperspirants cause breast cancer, because there have been online and social media rumors that suggest that chemicals in underarm antiperspirants are absorbed through the skin, they interfere with lymph circulation, they cause toxins to build up in the breast and lead to breast cancer. Based on available evidence, there's little, if any, reason to believe that antiperspirants increase the risk of breast cancer. Okay. Another one is bras. There are online and social media rumors that suggest that bras cause breast cancer by obstructing lymph flow. There is no scientific or clinical basis for this claim, and even a 2014 study conducted on more than 1,500 women found no association between wearing a bra and breast cancer risk. So, ladies, those of you that have been saying, I don't want to have breast cancer, and you have, because of that, neglected wearing your bras, please think again. Wear bra, dignifies your breast, so to speak, instead of just leaving it dangling and all of that. There's no association between wearing bras and having breast cancer. Okay. Finally, let me talk about preventive tips. How to prevent this breast cancer I've been talking about since morning. See, it is my mantra that prevention is better than cure, especially when it has to do with a disease for which no cure has been found yet. Of course, there is no guarantee for anything in life. You may take all the precautions and still have breast cancer, God forbid. But it is better to do all in your power to prevent this than blaming yourself later and thinking that you were the one who caused it because of your lifestyle or your negligence. Just live by the book to be on the safer side, okay? So, the first prevention tip I'll be talking about is maintain a healthy weight. It's just like word and opposite with risk factors. I've talked about obesity as a risk factor. So maintain a healthy weight. Exercise regularly to lose fat, you know, eat healthy, especially after menopause. Try and eat more fruits and vegetables just so that your weight is in the right place. And exercise too. Limit alcohol or even avoid it totally if you can. That is another way to prevent having cancer, okay? Take at least 400 micrograms of folate every day through your diet, or you can use the supplement. That is a DNA forming like a molecule. It helps to prevent genetic mutations. Do you understand? Then stay active, exercise, do not be sedentary. It also helps with your weight. It really helps you to be flexible. It gives you balance. So if you exercise at least 30 minutes every day, it is very good for your health. It helps your cells to stay healthy and prevent all these abnormalities. Okay, I've talked about eating healthy diets. You cannot never overemphasize that. Add whole grains, vegetables, fruits to your diet. You'll be glad you did. Reduce red meat, processed meat, sugary drinks and sodas, processed food, foods high in fat and starch. Reduce all of that, okay? And for new mothers, the 6 months exclusive breastfeeding thing they're saying, it's not just for the benefit of your baby, it's also for your own benefit too. You should breastfeed. If you do that, it reduces your risk of breast cancer. Okay? It really does. Then avoid smoking. Research has shown that smoking carries a high risk for cancer, not just breast, many types of cancer. So why not just avoid it? It's not only lung cancer that smoking affects. So manage your stress, okay? Practice meditation, deep breathing, regular exercises also help to manage stress. Take breaks, okay? Even from social media, because social media sometimes can be stressful. It can stress you out mentally and everything. Take breaks. If you need help from a psychologist, like I mentioned earlier, talking about mental health, please do. Because your mental health at the end of the day affects your physical well being too. See now, everything is connected one way or the other. And prevention tips for patients at high risk of getting this cancer, like those that have family history, you know, those that have been exposed to radiation that I mentioned earlier. Please go for screening from time to time. Early detection is the best, it's part of the prevention of cancer. If you detect it early before it metastasizes, you can still nip it in the bud before it goes to organs where it can't be touched anymore. Do you understand? If you know you're at high risk, you have family history of it, please go for screening from time to time. It is very important. Then there are some medications too that have been used for preventive, like tamoxifen. Okay, it's being used, but you have to see your healthcare provider before you start on it. You cannot self-medicate. You know this. Then there's this thing called prophylactic mastectomy. That's on the extreme case. I know a lot of people know Angelina Jolie, and we heard news then that she had a prophylactic mastectomy because breast cancer runs in her family. So that she doesn't have it, she cut off the breasts and replaced them with artificial ones. That was what she chose to do. If you know that you have high risk, it's an option for you, okay? Thank God that science has evolved and you can actually get artificial breasts. People may not even know the difference. You get, it's just to prevent having the cancer in future. Do you understand? You have to talk to your healthcare provider about all of this as well. You know, science is evolving, like I said. There are ways now to actually even detect mutations early in genes. Of course, they are expensive procedures, but they can be done. Once they have noticed some mutations in your BRCA1 and 2 genes, you might decide to have a preventative or prophylactic mastectomy before it results to breast cancer, right? But note that even having preventive mastectomy does not mean that you may not come down with the cancer eventually. So, this cancer thing, get as it be. And that's a wrap on today's episode. Thank you so much for listening up to this point. I hope you got value as always. Please like, share, follow, and subscribe to the podcast to help me grow it. And also comment, okay? I want to know what you think about each episode. I actually need the feedback. Don't forget that Anti-Pharmacist Podcast is on Apple Podcast, YouTube Music, and other podcast hosting channels like Castbox. So it's not only on Spotify. Oh. Please and please do listen in. Genuine health information are scarce in this age of misinformation. Why not take advantage of this opportunity to get authentic information about your health, well being, and medications from a qualified healthcare professional? Please also engage on social media when you see our posts, okay? You get to see the post when you follow, so please do follow Farm Podcaster on X and the Pharmacist Podcast on Instagram, Bemisola Adebisi Jose on Facebook and LinkedIn. You can send your official correspondences and calls for collaboration to anti-pharmacist-podcast at gmail.com. Till next time, stay healthy and God bless you.